Thank you, everybody, for joining in our first dealer webinar of 2018. I can't believe when I was putting these slides together yesterday, writing 2018 is still a little weird. We're going to be talking about mare fertility, and obviously when we talk about mare fertility, we're talking about what are we feeding these mares. And it's not just looking at fertility, but also looking at, when we're talking about reproduction, the goal is really a foal. But there are two factors that go into that, the stallion and the mare. We always say genetically it's a 50-50 split, but phenotypically the mare has so much more role in the development of that foal, nutritionally as well. So we'll focus on the mare today. Sorry if I sound a bit terrible. I have two little kids. Kids are sick all the time. So we'll look at some nutritional requirements. We're going to look into pregnancy a little further, though, and look at what happens if these horses are overweight, maybe have insulin resistance or suffer from some of those metabolic disorders, and how that actually may affect the foal in utero, and how that long-term can affect the foal. Because it's funny, we're thinking about, right now we're just trying to think about getting her pregnant. But immediately after she's pregnant, we need to think about feeding that foal, maintaining her pregnancy, and at that point on, we are now feeding the foal. Once the foal is born, it's already been fed for 11 months. So we cannot forget that, because that is so absolutely critical. So we'll start out with the nutritional requirements of the mare. Reproduction is not a given. If the mare is too thin, she's never going to get pregnant. So it's a bonus. It only occurs when the mare has adequate nutrition and body reserves. Mares will not become reproductively active until they have proper nutrition, adequate nutrition. Now, we also know that obesity can interfere with her fertility and her reproductive cycles, but she just will not cycle if she is too thin. It's all centered around nutrition, increased day length, i.e. light. And that temperature, increased nutrients, signals mares that reproduction is possible. So that's why we go ahead and turn lights on this time of year if we want to get those mares to start cycling earlier, because it actually is 100% to do. It's not as much about temperature at this point as it is about day length. So if you're extending the amount of daylight that they're signaling, then they will start to cycle earlier. So when we think about the horse's body condition, though, we really need to use not so much a weight tape or a scale, but an estimate of body fatness is body condition. So we need to be very familiar with body condition. This is this 1 to 9 scoring system that we talk about often, but I thought it would be good to just go over it again. Obviously, that is a weanling yearling there, so it's going to look thinner. But ideally, to body condition score a mare first. And this is the very first place you start. When you want to get a mare pregnant, this is where we start. We first of all assess her body condition. That's going to dictate what you're going to feed her. So we want to take an estimate of all of these areas. We're going to look over her neck, over her withers, over the rib cage, right where you would do the girth up, the flank, the tail head, and you're going to take an estimate of all of those areas to judge body condition. Now, 1, they're going to be super skinny and probably very depressed. At 2, we've got a little bit more even coverage. You can definitely still see the bones sticking out and see the ribs. 3, you can note now we've got a bit more even coverage compared to the 2, but still I can see the ribs and I can see the bones sticking out. Now 4 is where we start to get into that gray area. A 4 may be ideal for some race horses or for some endurance horses, but for mares getting pregnant, you're going to be on the edge of success here because it's not very successful if you have mares in a body condition score of 4. A 5 and a 6 are ideal. 5, you can see I can no longer see the ribs. We've got an even coverage. When I'm palpating that mare, putting my hands on her and touching her, then I don't have to press really hard to feel the ribs. 6. Now 6 here, we have even more coverage, but this is still ideal. A 7 when it comes to brood mares. Okay, so if your mare is a 7 now and you want to get her pregnant really quickly, in January, then don't put her on a diet now because that's, when she's losing condition, that signals to the body, oops, no, we may not start cycling. So you don't want your horses losing condition right now. You want them either gaining or maintaining. But a 7, as we progress into the 2nd and 3rd trimester, you may want to exercise them a little bit more. 8 and a 9 are really too overweight. You're going to start to run into issues with metabolic disorders, them holding on to their CL so that they won't continue to cycle, irregular cycles. So fertility obviously is decreased if you can't get those mares to cycle. So as I mentioned, a 5 or a 6 is ideal. They'll cycle earlier in the year. They'll have decreased services per cycle. That's really important. If you have to keep taking your mare back to the stallion, that's expensive. It's a lot of wear and tear on the horse, on just going to the stallion, or if you've shipped your mare to the stallion, then you're paying every day that she's there. And obviously all of that leads to an increased number of pregnancies. Horses in a body condition of 3 or less, we consider these underweight. You're going to have longer periods between that cycling, so we call that the interovulatory period. They may ovulate here and there, but it's not consistent, so you can't track it. And there's very long periods in between. We've got much less ovarian activity. Obviously, that leads to a decrease in conception rates. They also are much harder to maintain pregnancy. That CL doesn't function very well. So if they're, a 2, 3, or that lower end of a 4, and they're just sitting there, or they're losing weight, then you're going to decrease your reproductive efficiency. However, let's say we've got a mare that's a 4 and she is actively gaining weight, then she may have more normal reproductive cycling because she's gaining weight. But a 2 and a 3, it's still, even though she's gaining, it's still going to be a little bit more difficult. But at a 4, if she's gaining, then you may have better reproductive cyclicity. Now, I find that most people have a pretty good handle on their horses being too thin, but where they struggle is horses being overweight. So a body condition score of 7 is considered overweight, and an 8 or a 9 is obese. And we know in people that are overweight or obese, their ability to get pregnant is really, really decreased. I know that a lot of fertility clinics will not take women over a certain BMI just because it's so unlikely they're going to get pregnant. So we have, I haven't included that 7 because I said that's that gray area where a 7, you'll probably still be able to get her pregnant, but later on you may have some difficulties as that foal is developing. So we really don't want these horses to be in a body condition score of 8 or 9. We're going to see hormonal imbalances, impaired cycling, poor rebreeding. Then they're also going to suffer from just the other metabolic issues like laminitis, impaired oocyte quality. Well, the oocyte is what it has to be fertilized by the sperm. So if that's already impaired, then kind of we're behind the 8 ball. reduced fetal growth, and that really affects our implantation and our early embryonic loss, and also this later on predisposition to disease. We know in humans and other animals that there is a huge connection to maternal nutrition and the children developing diseases, childhood diseases. So let's look at that pregnant mare, early gestation, less than 6 months, similar requirements to maintenance. These minerals crucial for early embryonic development. There are increased body condition if needed, if she's a 4 and you want to get that increasing. Light exercise if she's too fat, but let's, in that early 3 months, I really don't want her to lose any weight, and we don't want to overfeed these mares. Mid-gestation, 7-8 months, now we're really increasing energy and protein, increasing calcium and phosphorus, and what can we feed this mare to improve immune status? This is now where we want the ingredients that may be in the DAC digestive aid, for example, the yeast, the biomass. There is a lot of research that shows us that biomass, the immune benefits that it gives the animal actually transfer across the placental barrier, and they benefit that foal. Now, we've talked a lot about these chelated or organic minerals versus sulfated or inorganic minerals. There's something else that I want to bring up. This is a worldwide issue right now. There is a lack, a shortage of vitamin A and vitamin E in worldwide stores because the facility that makes the kind of precursor to vitamin A is in Germany, and they had a fire and the whole factory burned down. So vitamin A is at a shortage. Vitamin E, most of it comes out of, the precursor comes out of China. And they've really stepped up their game and improved their quality control, but in doing that, there is a bit of a shortage. So we need to make sure that we're feeding other ingredients that might also enhance the natural availability of those. So the research has shown us, by adding chelated minerals to the diet, we can actually unlock more vitamin A and vitamin E. So the fact that all of the DAC supplements have chelated or organic minerals is really, really important, especially right now when we're going through this lack of vitamin A and vitamin E. Also trying to feed them a lot of forage, green forage. So late gestation, 9, 10, 11 months. Now really, when we've got the early gestation and mid-gestation, this is where we're doing all of that foal growth. In late gestation, all we're doing is laying down tissue and fat. However, minerals are absolutely still critical because at this point we are fortifying that fetal liver, so that in utero foal's liver is being fortified with trace minerals. Because mare's milk has a very low amount of minerals. So that foal has to be able to draw on those stores until it starts eating its own food. So that's going to have to last them about 1 or 2 months, maybe even 3 months before they really start eating a lot of their own food. So here you can see the exponential curve here in protein in grams per day and energy. So for that first 4 months, our protein and energy requirements are pretty stagnant. They're very similar to that maintenance mare, but as we now get into mid-gestation and late gestation, the protein and energy requirements increase because that foal is laying down more tissue. Early lactation, however, is where we will see the highest requirements for protein and energy, months 1, 2, and 3. But then it's going to really start to drop off. So it's really, really important that you're feeding a good quality hay at this point. So at this point, you need to be adding alfalfa to the diet. If you're doing a very basic oat-based or grain-based feed for your broodmare, you need to be feeding them a lot more protein to support this. And that protein that's going to come from soybean meal or from alfalfa is high in all those other really crucial amino acids. So let's look at pregnancy and exercise, because a lot of times we forget about exercise, but if we're now considering that foal and the best outcome for that foal, research in humans suggests that the cardiovascular system in that in utero baby, that fetus, it's responsive to moderate maternal exercise. So if the mother is exercising, we increase blood supply to the baby, which is increasing oxygenation to the baby. And what they've noticed is their cardiovascular system, their lungs, their heart are more developed, and their nervous system is a lot more mature when they're born. Those children also later on in life have much improved cardiovascular health. Now, for a lot of us, when we're thinking about foals and we're thinking about what they're going to do in later life, thoroughbreds or standardbreds, for example, cardiovascular health and capacity is one of the biggest factors for their success. So if in utero you can be affecting that, then absolutely you should be doing that. How can you do that? Well, if you don't have a fancy treadmill or exerciser, you can do some light lunging, or even just force exercise by keeping them out in fields and putting the water in a different area to the hay and a different area to the feed. So it just forces some exercise. Whoopsie. So how about the metabolic status of these mares? Let's just look at this. Glucose and insulin, for example. If we have obese mares, this comes back to fertility. Obesity decreases fertility. It decreases your ability to get her pregnant. But I said it had lasting effects. Let's just say you do get that mare pregnant. Well, glucose, it is an energy substrate that nurtures the development of follicles. It's important, but not too much of it. Maturation and ovulation of the dominant follicle, and formation and maintenance of the corpus luteum. So glucose is important for all of those. Insulin can affect follicular development. Not enough insulin, like insulin-resistant animals, have been shown to have cystic ovarian disease. We've seen that in cattle. And polycystic ovarian syndrome, so instead of getting nice follicles, they'll get a lot of cysts on the ovaries, is what we notice in women, and we have seen that in horses too, that are overweight and get insulin resistance. We also know that there is this delayed intraovulatory period in these obese mares. And some work out of Kentucky showed us that corpus luteum just doesn't seem to go away. And there was a suspicion that maybe insulin has a stimulatory effect on progesterone. So we really don't want obese mares, number one, because it decreases fertility, but number two, because it will end up affecting that fetus in utero as well. So insulin-resistant mares, this is actual mare research. Insulin resistance or present signs of equine metabolic syndrome. So maybe they've got a crusty neck. They will have a greater number of small and medium follicles, but they really don't develop a lot of large follicles. And using HCG to induce ovulation, the effectiveness is very low. So for those of you that are in the breeding world and you're trying to get mares pregnant, all of these things make sense to you. You don't want to have a lot of small and medium follicles that never develop. You want, if you're synchronizing mares and you want them to ovulate exactly when, is convenient, then you need to make sure that they're not overweight or suffering from insulin resistance, because it's going to obscure your chances. So elevated insulin in the follicle can affect follicular function, and it affects the hormones. In mice, the addition of insulin now this is all in a little petri dish, but these oocytes don't develop properly if there's too much insulin. Equine metabolic syndrome is associated with the follicular changes. We have abnormal metabolic hormones. So overall, it just leads to a decrease in fertility. So let's talk about the pregnant mare. Now, I know this looks a little crazy here, but we know that insulin is responsible for pushing glucose out of the bloodstream into wherever it's got to go, whether it's going into the muscle or into through these different pathways here. So we've got, these are called transporters. We've got the GLUT1 transporter, we've got the GLUT3 transporter, we've got this GLUT4 transporter, which goes to skeletal muscle and fat. And insulin drives that glucose through those transporters. Insulin secretion, though, is stimulated by glucose. So if there's a lot of glucose, the body says, oh, I got to produce a lot of insulin because I got to push all that glucose through. And if we have a breakdown of that insulin, if these GLUT transporters are resistant and that insulin's not working, then we'll have also a lot of insulin floating around. So if we're not able to move that glucose, we're going to have all this extra insulin floating around, and that has its own set of side effects which are detrimental to fertility. What is insulin resistance? Well, it's a decreased response to insulin. I say that insulin is broken. That GLUT4 transporter you can't push glucose through there. But what happens during pregnancy? Well, during pregnancy, we actually, instead of pushing a lot of glucose to this little skeletal muscle, we end up pushing more to the fetus. And so we have this kind of transient decreased insulin sensitivity anyway. This was some research. I won't show you a lot of it, but some research that was done at my research program many years ago, just looking at glucose and insulin in mares and how that affected the foal. Because we really then look at this kind of genetic programming, and as I said, the minute you start feeding the foal is the minute it gets pregnant. That mare gets pregnant. So pregnancy, we have this transient insulin resistance, which is normal because we're pushing less glucose into that skeletal muscle and we're pushing it into that fetoplacental unit. If it gets severe, women get this gestational diabetes. That fetus, though, that fetoplacental unit is very glucose reliant and they don't need a lot of insulin. Whoopsie. Now, depending on what you're feeding these mares, we know that when you feed a lot of sugars and starches, a high oat, corn, barley type diet, that is going to give you a lot of non-structural carbohydrates. And you're going to see a very large glucose spike in those animals, and oftentimes a lowered insulin sensitivity. Now let's look at these mares. So the blue and the pink ones, these are pregnant mares. The blue mares, they're pregnant and they're eating a lot of sugar and starch. And look here how we have this huge glucose spike. The pregnant mares here in pink, they were eating a more beet pulp fat-based diet, and they didn't have that huge glucose spike. Nor did these green dotted ones here. These are non-pregnant mares eating that sugar and starch. So they're still eating a lot of sugars and starches, but they're not pregnant, and so they're not having that huge spike. So what I'm showing you here is pregnancy alters that ability to deal with sugars and starches. So if you've got an overweight mare and you did get her pregnant, do not feed her a lot of these sugary, starchy type foods, because it's going to even further exacerbate this glucose, which later on will affect the fetus. This is showing you the same, reaction of insulin, okay? So if you have a lot of glucose, then insulin has to get secreted to get rid of it. So this also, we noted that foals born to mares that were eating a lot of sugars and starches, around 80 days of age, we noticed some changes in their glucose and insulin, and around 160 days of age, they had a trend for decreased insulin sensitivity. So they weren't insulin resistant, but it was changed in the horses, in the foals that were born from mares that ate a lot of sugars and starches in their diet. What could that lead us to later on? We know, we'll talk about these fetal origins of disease first. So we know that more developmental milestones occur during in utero or fetal development than any other time in that animal's life. We know that based on what that mare or woman is eating, we have the opportunity to prevent disease or predispose disease in early life. This is an interesting. This will kind of give you a visual. So during the war, where the people were in concentration camps, Nazi concentration camps, and the food supply was very short. It was in the winter. They were getting very limited calories per day. But these people were surviving. They were barely surviving. Some of those women even got pregnant. Later on, 60 years later, the children that were born in those camps to women that were severely malnourished, that was 2005, and these people were about 60 years of age. And if we looked at those people, they had an increased incidence for obesity and diabetes. So it also shows you that severely malnourished horses, they can also affect their foals, as well as severely overweight mares. So factors that are going to influence that fetal development, obviously we know the mare's nutrition, obesity, and exercise. The mare is going to be feeding all that good nutrition to that foal while it's growing. Obesity is going to be changing glucose and insulin dynamics, which can have a negative effect. And exercise is also going to speed up cardiovascular development. So this here really, for me, says it all. That early environment, in utero, while that fetus is developing, the mare's nutrition and physiology has so much to do. That is the most important time for feeding that foal. Because we can then, in here, predispose these foals later in life to developing obesity, insulin resistance, laminitis, joint disease, and equine metabolic syndrome. It's in here that we are predisposing these horses to here, not during postnatal nutrition. This has much less role in the foal development than in early in utero development. The very last thing I want to show you is some research done on recipient mares. This just goes to show you how much the mare and the mare's phenotype and the glucose and insulin dynamics in the mare is affecting the foal. Okay, so if we cross a pony with a pony, and then through artificial insemination, we might embryo transfer that embryo into a draft mare. So we'll have a normal pony and a pony. That's going to be in the yellow boxes, normal mating. Then if we take that pony embryo and we put it in a draft mare, that's going to be in the blue boxes. Then if we have a saddlebred crossed with a saddlebred and we take that embryo and we either put it into a pony, or we put it into a saddlebred, or we put it into a draft horse. And we see what this maternal environment, how it affects the outcome of those foals. So we've got glucose here. We know that ponies are predisposed to have high glucose and insulin. They're very easy keepers. They're very predisposed to insulin resistance, metabolic disorders. So that foal, the pony and the pony, it has high glucose. That would be what we would expect. The saddlebred and the saddlebred, we would expect that not to be as high as the pony. The pony and the pony, again, in the yellow, but compare that when you take that pony embryo and you put it into a draft mare. Now that draft mare is having a huge influence on that embryo, and we don't get that huge spike in glucose from that foal that was born. Now, another one that's really interesting. We take a saddlebred. This foal shouldn't have high glucose, but if you put it in a pony, which is this pink dashed line here, now that pony mare's in utero environment is playing a huge role, and we have elevated glucose again. So that really just shows you that the mare has way more influence over that foal than you really realize. 50-50 genetic split, but phenotypically the environment that foal is growing in has long-lasting effects. So what supplements do we have when we're thinking about feeding these mares? Well, number one, we're going to look at body condition. We're going to look at the base diet we're feeding these mares. Are we feeding them high sugars and starches when they're already overweight, or do we need to be increasing body weight so we're adding a lot of fat to the diet? But what else are we going to be adding? Well, the Breeder's Choice Plus is our vitamin mineral supplement. It's higher in vitamin A and selenium, which we know are critical for fertility. It's chelated minerals, so it's making those more bioavailable. The Orange Superior, it doesn't have quite the level of vitamin A in it, but is still, if you've got mares that easily get pregnant, Orange Superior is really good for just giving them a balanced vitamin mineral supplement and getting them on a good plane of nutrition prior to going to the breeding shed. So now, if you're thinking about breeding a mare, you really need to make sure that even if she's in good body condition, that she's getting adequate vitamins and minerals. She doesn't need a lot of extra calories, but she needs to get those vitamins and minerals. Now, we've also thrown around Breeders Excel for stallions. We know that it's important for seminal quality, seminal health, that's going to affect the stallions, but at times we've mentioned that this omega-3 fatty acid DHA may have a role in ovarian function, and a lot more research has been done in cattle, but I don't think we can discount that just because it hasn't been done in horses. And we know that once mares get pregnant, those mares, well, it was actually cattle that got pregnant, those cows, they had a better ability to maintain pregnancy when they were getting supplemented with DHA. And they suspected because it helped make that CL a lot stronger and it was producing a lot more progesterone. So I think that the Breeders' Excel also has validity for improving ovarian function. If you're trying, you've got an older mare and you're really just trying everything, Breeders' Choice Plus combined with the Breeders' Excel will be a very good complement. If you've got mares that get pregnant every year, there's no issues, then the Orange Superior is fine. They may not need the Breeders' Excel if we have no difficulties with pregnancy. So our first question has come in. I have a client breeding thoroughbred mares. She's feeding them orange, DDA, and oil. Would there be any reason to put them on Breeders' Choice Plus? She's got good grass, hay, and alfalfa fed as well. It depends. For me, if I had a breeding farm, I would have probably both Orange and Breeders' Choice Plus in my feed room. And the majority of mares would probably get Orange, but if I had any that year after year were harder to get pregnant, then I would probably have them on the Breeders' Choice Plus. I typically recommend that more for mares that are a little more difficult to get pregnant. Also, the older mares, especially if those mares are aged and they haven't been pregnant in earlier years, so we've got a 12-year-old mare and we're going to breed her now and she's never been pregnant before, then I would be more inclined with those older mares to put them on the Breeders' Choice Plus just to improve my chances. So do we have other questions? You can type them in, but those on the phone can't do that. So we'll see how we go if we unmute this. If a mare is already on DHA, do they need either of the others? Now, the DHA and the Breeders' Excel are an omega-3 fatty acid supplement. So if they're on the DHA Perform, you wouldn't need to switch them to the Breeders' Excel. They can stay on the DHA Perform, but neither the DHA Perform or the Breeders' Excel have any vitamins and minerals, so they would absolutely need to also be on a vitamin mineral. Whether it's Breeders' Choice Plus or Orange Superior is your choice. Had my mare on the DHA for joint benefits and she became hormonal crazy. She's never been a strong vocal, cycling when in heat, but yeah, I don't know that the DHA would change hormones like that. But, let me unmute everybody, and if it's terrible, then we'll have to change. Okay, so you can go ahead and ask questions. What feed program do you recommend for the obese mare that is pregnant? Last year's foal was extremely small and she is bred back. Yes, that is very typical of obese women and obese mares, as they have tiny babies because there's not a lot of room in there. Depending on where she's on DDA and Orange Superior, well, she's pregnant. In the second trimester, you need to exercise her and get her in a better body condition. Don't do it in the first trimester, but in the second trimester, you need to exercise her. If a mare is on DHA Perform along with Foundation Formula and DDA, do we need to add Orange? Yes, because there is no vitamin mineral supplement in that you've just described to me. DHA Perform, Foundation Formula, and DDA will not supply all of the vitamins and minerals that you need.
The broodmares.
Whoopsie, I think somebody was trying to talk.
What is the role of DHA? If you could discuss.
Okay, DHA is an omega-3 fatty acid supplement. That's all it is. It's got no vitamin or mineral in it. It's an omega-3 fatty acid supplement. We know from research that affects semen quality and semen health, and there is also research to suggest that it affects ovarian and oocyte quality. But you need to combine it with a vitamin and mineral supplement. It can't just be fed as a standalone.
Excellent. Thank you.
No problem. Other questions? Okay, well, wherever you are, stay warm.
When do you